I'm Robert Vaschak. I'm a DO out of Ohio, and I am an internist, and have been that way for 35 years. Culinary medicine, to me, was more of a re-energizing type of thing for me. I graduated in nutrition out of the Ohio State University, and have used nutrition throughout my practice. And it was just more of just kind of re-energizing me. To me, it's interesting is that we have patients that, I mean, everybody is a nutrition expert now, and mostly it's supplements and all this. But I've used nutrition throughout my practice every day. And then I came across the culinary medicine program in one of the clinical trade journals, and I saw Dr. Harlan and read a couple of his articles, and it was intriguing, and thought that yeah, I should go ahead and get that title. And it was interesting is because as soon as you get a title, now you're the expert, so it's added that way. And again, I used the nutrition throughout the day, so I mean it was fairly easy for me to do that. No, not at the time. I didn't. Yeah, and I think that was 5 years ago or so.
Oh, okay.
Well, maybe it was longer than that,
Okay.
but I wasn't doing the Zoom. I did it all at the Gold Ring, and yes, I promote it all the time. Yeah, so I'm always trying to tell them to come down to the conference, and that they should get a culinary medicine certificate. And I think that and again, when I see patients, it's interesting again is that they'll all say, well, doctors don't get nutrition, and then they run into that. Even my nurse practitioners, would run into that. So I said, you get something like this. I said, you'll learn, and then you'll be able to teach them, and also tell them that, well, listen, I've got some expertise in this. Probably pesto, yeah, and I'd have to say basil.